Morning guys, Dr. Chris from Acru Health here. I got a great question that I want to answer for you guys today that several patients have asked us recently, and I know you're probably wondering this yourself. Why don't we crack your back or your neck? Right? If you've been coming to Acru Health for long enough, you've realized that we don't do more of the traditional old school kind of manipulation style adjusting. And so why is that? Why do we do a different approach? Why do we use this instrument that we use? And you may be wondering that yourself, or you might have family or friends that are asking you about the chiropractors you see, and you want to feel like you can better explain what we do or why we're different. And so I want to answer that today. Now, to answer that question, there's a couple things we have to address. Number one is, what is the purpose of an adjustment? Okay, like we've talked about many times, the number one purpose of an adjustment is to remove any subluxations from that spine that are affecting the nervous system, right? Just like we've talked about before, your brain sits on top of your skull here, top of your spine, and it constantly is in communication with every part of your body, every muscle, every organ, every gland, every system, through all of these nerve roots coming down off of that spinal cord that go to every part of your body. Right? So anytime there's any kind of misalignment, shift, change from any of the daily stresses of our lives, from childhood all the way throughout our life, it can impact how that communication functions, right? And as we know, like any relationship, communication is the foundation of a healthy relationship. If there's poor communication, nothing functions or works like it's supposed to. Now, in terms of an adjustment, when chiropractic was founded, chiropractic was all done via hand. And there's nothing wrong with that. There's amazing adjustments that can be done via hand. And both myself and Dr. Raphael were both trained to adjust manually with our hands, like maybe you've seen on videos or you've seen with the previous chiropractor or things like that. So there's nothing wrong with it. The question is can we make it better, or can it be more specific? Now, if Alexis comes in here and kind of comes in on a video, if I were to kind of come onto the spine here, right, and obviously if this is a real person, and I was coming down and I wanted to make a specific adjustment, I would try to force down into this and make whatever specific adjustment I wanted to. And you can do a very good job of trying to be as specific as possible, but no matter if it's in the mid back, or we're putting somebody on their side and we're dropping down into their low back, or we're adjusting their hips in this way, or we're turning their neck and we're making those changes in this direction, there's still a lot of things that we're moving. And so it's hard to be incredibly specific when it comes to that. And the whole purpose of the crack, quote unquote, or what that noise is it's actually called a cavitation, right? If I take my fingers and I push them past their end range of motion, you'll hear that sound, right? So the sound, or that cracking sound, has nothing to do with the effectiveness of an adjustment. All it means is we're taking that joint past its end range of motion, and you're hearing a release of gas from that joint. That's what the sound is. So the quote-unquote crack has nothing to do with the adjustment, and a lot of times we've kind of associated those two things together, that an adjustment is effective because you heard a noise, and that couldn't be further from the truth. Now, the reality is that we use an instrument called an integrator as a part of the technique that we utilize called torque release technique. And this instrument allows us to be very, very specific. So we preset that instrument, and if we come onto the spine, right, we're able to come onto one specific section or one segment and make a specific correction, right? Or if we're wanting to get up into that neck area, we can get onto one specific vertebra and make a very specific correction just like that. So these adjustments allow us to be much more precise, much more specific, so that we can make those corrections of those subluxations as precise as possible, to make sure that not only you're getting the best results possible, but that this is the best and most effective and gentle way for your body to receive those adjustments as well. So, just like science and technology and everything is constantly changing and adapting, we are too. And so between the computerized diagnostic scans that we utilize here in the office and the instrument-based adjusting, we are focused on creating the most effective and efficient system for you guys to get the best care possible and keep you as safe as possible for you and for your family. Again, I'm Dr. Chris. If you guys have questions about this, ask us at your next adjustment. Share this video with your family or friends that may be asking about chiropractic care and don't know that there's another way. I hope this brings some clarity to that question of why we don't crack your back at Acru Health. Thanks.